Hello, everyone. Thank you for joining us today for our webinar entitled Evaluating the Security of Your IT Network. Today's presenter is Kyle Stafford, MCEDA's Technical Health IT Security Specialist. My name is Liz Jones, and I am today's moderator. Before we begin, I have a few housekeeping items to touch on. We will be keeping the phone lines on mute during today's presentation. If you have a question for Kyle, please type it into the questions box in your GoToWebinar interface. We'll take time at the end of the presentation to answer any questions you have. If for some reason we are unable to get to all of the questions, we will email you directly with an answer following the broadcast. We will also be posting a recording of today's webinar and a copy of the presentation slides on our website. Go to www.mceda.org, hover on the Resources tab, then select Webinars. The information you will hear in this broadcast is current as of today and is only intended to be a general summary. Since policies change frequently, the best way to stay up to date on current requirements is to review the actual written law or regulations. We encourage participants to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement of their content. Today we will start out by giving you a brief overview of MCEDA and our various service offerings. Following that, Kyle will take over and discuss important fundamentals in establishing the security of your IT network. Following the presentation, Kyle will take time to answer any questions posed by the attendees. Housed within Alterum Institute, we are MCEDA, the Michigan Center for Effective IT Adoption. Originally born out of ARA, and more specifically the HITECH Act, MCEDA is Michigan's Rural Extension Center, tasked by the federal and state governments with accelerating the selection, adoption, and meaningful use of health information technology to improve the quality and efficiency of healthcare in our state. To date, we have assisted nearly 6,000 providers across Michigan, impacting 1.6 million patients annually. Ranked as the 5th largest REC out of a national network of 62, we are also funded by the state of Michigan to assist any provider participating in the Michigan Medicaid EHR incentive program. MCEDA's health IT services include the following. Number 1, meaningful use support at any stage in year. Providers participating in the Medicaid EHR incentive program also benefit greatly by qualifying for state-subsidized services that bring our highly rated technical assistance to you for only $200 per provider, a savings of 96% compared to commercial service rates. Number 2, security risk assessment, which is an embedded service within our meaningful use support. But if providers only need assistance with the SRA, for example, to satisfy the requirements of the new quality payment program, we offer it separately as a standalone service. Additionally, MCEDA is helping practices improve their technical security with the new Network Security Evaluation Service, which can be purchased to complement our other offerings. Number 3, attestation and audit preparation. If you are getting ready to attest and just need some peace of mind that you have crossed all the T's and dotted all the I's, or if you're one of the many folks who have been selected for an audit and need assistance responding, we are here to help. Number 4, targeted process optimization, or TPO, takes a stripped-down version of lean principles and applies them to any clinical or operational practice improvement initiative. No matter what you need help with improving in your clinic, we have experts on hand who can assist. Number 5, the Great Lakes Practice Transformation Network offers no-cost technical assistance to eligible providers in support of quality improvement initiatives, PQRS support, and preparing for upcoming advanced payment model changes under the new quality payment program. Number 6, our chronic care management program enables physicians to take advantage of the recently updated Medicare billing requirements for CCM services. We provide you with a dedicated care manager who works within your practice helping fulfill CMS criteria to maximize your reimbursement potential. Contact us to learn more. And number 7, funded by the Centers for Medicare and Medicaid Services, the Quality Payment Program Resource Center for the Midwest provides free help to clinicians in small practices and rural or underserved areas as they navigate participation in the CMS Quality Payment Program. Go to www.qppresourcecenter.com to join today. With that, I will turn things over to Kyle.
Hello everyone, my name is Kyle Stafford. Today we're going to be talking about rise of hacking attacks, as well as going into an in-depth look at vulnerabilities, network mapping, and how they all relate to compliance. So this first slide will be talking about how hacking attacks have not only increased, but how it's actually been increasing drastically throughout this year and how it compares to last year. At the moment, hacking attacks have increased by a rate of 320% compared to previous trends. This information was provided by healthitsecurity.com. At the moment, 113 healthcare providers within 2016 had reported a breach that had accumulated 500 or more patient records. And all of those were in specific relation to hacking and IT incidents. At the moment, the average cost of a patient medical record has increased to $402. So that number would be the amount of money it ideally would cost your practice for each medical record that was breached or compromised. This is an increase of 5.4% compared to last year. So this is a number that has been increasing every year. The average size of data breaches have now increased by a rate of 3.2%. Of course, the faster you identify a breach, the more money, of course, it will save you. You can go to the U.S. Department of Health and Human Services, where they have a list of all the reported breaches of all entities which had 500 or more records breached. So in 2016, there was 113 different covered entities that had experienced a breach of 500 or more records, and those were all related to hacking and IT incidents. That, of course, is a drastic number comparing to 2015, where there was only 57. There, of course, has been more medical record breaches than there ever has, especially comparing to 2017, where already we have 38 incidents that have been reported that have breached 500 or more records. Right now, there is 969,000 individuals that have already been affected this year in 2017. Of the list of breaches on the HHS website, 75% of all individuals that have been affected are all in relation to IT and hacking incidents. Of the reported breaches right now, 15% is the only column related to IT and hacking incidents. But as I mentioned before, 75% of all affected individuals are related to hacking and IT incidents. Hacking and IT incidents now make up a large accumulation of all affected individuals. So how are these hackers getting into your network? How are they breaching and getting a hold of your patient records? So these are just a few examples of some ways that hackers are taking advantage. Of course, they are able to exploit vulnerabilities and weaknesses that they're able to see within your network. Most of the time, practices are going to have insufficient security controls that aren't able to defend against any hackers. So the bare minimum security controls are not enough to prevent a breach anymore. Therefore, we need to increase our security and adjust accordingly. So the first thing you want to do is be aware of where your weaknesses exist. So there's going to be a couple ways that you can start evaluating your network and identifying where your most critical assets lie. And then on top of that, you're going to want to ensure that you have appropriate measures implemented to mitigate any risk. You, of course, are going to have a lot of connected machines in your network, and it can be difficult to really determine where to start and where your weaknesses lie. So vulnerabilities right now are housed on the National Vulnerability Database website, which is hosted by .gov. You're able to go here and see what the amount of vulnerabilities are totally accumulated, and you're going to see that they're actually updated daily. So if you come here today, it's going to be a different number, of course, than tomorrow, as vulnerabilities are identified every minute. This year, right now in 2017, there's already been 5,360 vulnerabilities that have actually already been added just this year. Total, the National Vulnerability Database has a total of 85,000 different and unique vulnerabilities. So vulnerabilities are going to encompass operating systems, software applications, different network devices, as well as your configurations. These are all have vulnerabilities, and they're all prone to exploits. So what you want to do is determine if your devices are prone to any vulnerabilities, and you're going to want to know how to handle them. So with a vulnerability, there's going to be some unique information about each one. So each vulnerability is going to be unique. It's going to be associated with a CVE number. And this is a common vulnerability and exposure ID. Each vulnerability is going to be unique, so each vulnerability is going to have a different CVE number. This is just a common classification that's used to sort. It's an open framework for ranking vulnerabilities. So a vulnerability has a CVE number and how it's identified. And with a vulnerability, you're also going to get a specific score. So each vulnerability is going to be unique. They range from low, medium, high. And introducing in the CVSS rating 3, they've introduced critical scoring system. So if you do look up a vulnerability, you will see that it's going to have an ID, it's going to have a score, and the score might vary depending on which version of the rating system it's using. So what you want to be able to do is, how are you going to be able to detect a vulnerability? Ideally, the best and most common method is to do a vulnerability scan. So a vulnerability scan is ideally the process of using tools to scan your network and devices and determine if you have any vulnerabilities present on your system. So the vulnerability scanner is going to keep up to date with the National Vulnerability Database. This is the best method to use, as there's so many vulnerabilities that are added, and the vulnerability tool, if it's updated, will have the most recent up-to-date list of known vulnerabilities. So why would you want to have a vulnerability scan? Ideally, there's so many different connected devices, it's really hard to keep up of where you have weaknesses. So this vulnerability scan is going to be an automated way in how you can detect and mitigate any attacks that a hacker could use to exploit. So running a vulnerability scan, how does it relate to compliance? So it doesn't specifically state that you need to have a vulnerability scan. But what it does do is it will be in relation to different security rules and HIPAA audit protocols. So if you do a vulnerability scan, you're going to be setting yourself up in a good position in the event that you ever went through a HIPAA audit or any meaningful use audits as well. This is a common method on how to meet the evaluation requirement for the security HIPAA rule. So this is pulled directly from the security rule itself. This is under the evaluation category. You will see that it states you must perform periodic technical and non-technical evaluations of your systems. So in summary, you're going to need to be able to document and identify where vulnerabilities exist on your network. So how do you know if you need a vulnerability scan? It's quite simple. Ideally, if you're a HIPAA-covered entity, this is going to be something that you will benefit from. If you have a computer network with devices that are storing critical information, such as EPHI, Electronic Protected Health Information, So if you have patient records that you're accessing on your local network, or if you have a cloud portal that you log into, a vulnerability scan will definitely be for you. Some other reasons you might want to get a vulnerability scan: if you previously had a vulnerability scan and you recently got any new hardware or you do any changes to your network, you will definitely want to have a vulnerability scan performed again. You might have updates that you might not be aware of, or if you have new hardware that's added, you might not be aware of what vulnerabilities some of these new devices possess. So how do you compare a vulnerability scan to a security risk assessment? So ideally, the risk assessment, you're going to be informed on where risk exists within your practice. So when you do a vulnerability scan, you'll be evaluating how secure your devices actually are. You're going to be pinpointed direct evidence as to where somebody could exploit a vulnerability and possibly how it could pivot to other devices on your network. So the need for technical evaluation is going to be a key role in terms of a risk assessment. So our process for a vulnerability scan would look something similar to this. With these five steps, the first thing you want to do is determine the scope of your vulnerability scan. So this would include what devices do you want to include and what devices do you not want to have part of the vulnerability scan. So looking into the first step a little bit closer, you want to ensure that before you do a vulnerability scan, the devices that you want to scan, some questions could be, do you have ownership of all these devices? You might have a shared space with another practice. You might be sharing your internet service provider's modem with another entity within the building. So you want to make sure that you have complete ownership of all the devices and that you have a legal right to access the device itself. The next step would be, of course, accessing the network. So you've already defined the scope of assets that you want to scan. So the next thing you want to do is make sure that when you do the scan, that the device with the vulnerability scanner can effectively communicate with the other devices. So when you place this computer that has a network scanner on the network, you want to be able to make sure that you're placing it on an appropriate position in the network, that it can communicate efficiently with the other devices. And ideally, you of course want to use a wired connection over wireless. With a wireless connection, it can be something that you might run into could be maybe wireless interruptions. If you have a wired connection, you will mitigate the risk of an interruption in the scan, and then you would have to continue the scan and possibly redo it. So the next step in a vulnerability scan would of course be to initiate the scan, but the scanner won't know exactly what it needs to scan. So this is where you'll input the information about the vulnerability scan. You'll be able to include devices that you want to scan. You can even do a scope. So you don't have to specifically input all the IP addresses of your computers. You can simply tell it to scan a particular range. If there's any devices that you do not want scanned for some reason, this will be the place to input it as well. You'll be able to whitelist and blacklist devices that you'd like to skip or hop over during the scan. So the next step would be, once you have all this information, and you're definitely going to get a lot of information when you do a vulnerability scan. More than likely, you're going to get information you didn't know that you could accumulate through a vulnerability scan. You're going to want to know how can you export all this information and then provide it to the appropriate personnel within your practice. So there's going to be some different options we'll have in regards to vulnerability scanning. You're going to be able to filter the information out. So if there's particular devices that you do not want part of the report, as maybe you picked up a rogue device that you might not want presented to other parties, this will be the spot that you can filter those out. And of course, you can also get a full detailed report. So if you work with any internal IT staff, or if you have an external consulting company that helps with your IT, we're going to be able to get a report for you that ideally would help them out in regards to remediating and mitigating any vulnerabilities that were identified. And the last step of a vulnerability scan would be to ensure that the results you have gathered from the report are presented to the appropriate staff. Ideally, this would include any practice managers, office managers, any related IT staff, of course, as well as any compliance officers. And something you want to take note of as well is that you're going to have to treat the vulnerability scanning reports as sensitive data. So you're going to want to take the same precautions that you would if it was critical or EPHI information. So you're going to want to ensure that the report is not easily accessible to anyone that should not be reading the information. This information should be on a need-to-know basis, as it's going to provide a lot of detailed information about your assets, of course, including vulnerabilities and exploits. So you might have the question of what types of assets could be included in a vulnerability scan. So I've listed a few examples here, and of course there's a larger range than this, but ideally it doesn't matter if it's a desktop or laptop, tablet or smartphone. These are going to be assets that you're going to want to include in your vulnerability scan. And of course that's regardless if the information is storing or accessing critical information. If it's on your network, you're going to want to know what vulnerabilities these devices have. Of course, with operating systems that's commonly used, you probably have Windows in your environment with a few Apple products, as well as Linux. So the Linux devices are probably going to be most of your network devices, so your routers, modems, firewalls, and switches. Most of the time, those are going to have Linux backends, and those, of course, will need to be evaluated as well. In software, I've listed a few examples of some vulnerabilities that you're going to want to be able to be aware of. Of course, your web browsers, any word processing software, your mail clients, and like I said, our range of operating systems will be evaluated as well. So this is going to be an example of kind of an overview of what information we're going to be able to display once a vulnerability scan is completed. So as you can see, you'll be able to have a decently readable information here that you can hopefully ingest. You're going to be able to quick overview of how many assets were collected during the vulnerability scan. You're also going to get a quick overview of what devices, based on our expertise, that you should address first. So like I said, you're going to have a lot of vulnerabilities and you might not know where to start. So having the information here gathered in an easily accessible way is going to help you start making sure your resources are dedicated to the right assets. And you can see the vulnerability severity. You're going to be able to get a quick overview of how many vulnerabilities you have and a visual representation of what your practice currently looks like. We'll have detailed information such as how we connected to the environment. Below, they'll also have different criticality vulnerabilities that we also display and that you can filter out. This is a more executive summary type information that can be displayed. So you'll see that there'll be a visual representation of the different severity vulnerabilities that were detected during a vulnerability scan. So this information will be quite useful for executive reporting, or if you have to send any information to upper management. There'll also be other detailed reportings, such as this one here that's going to give you a very zoomed in look on a particular vulnerability. So what you see now is a particular vulnerability on a device, and you're going to get a description of the vulnerability. And like I mentioned earlier, there's the scoring there, so you can see how critical the particular vulnerability is, and a solution is also provided on how to address the vulnerability. So this type of information is going to be provided for every single vulnerability that we do find. So understand your network. So now that you have a list of devices, and which ones are vulnerable, as well as what steps you need to take to address the weaknesses, what you need to know and be aware of next would be if somebody exploited a vulnerability that was detected, where and how could they pivot across the network and affect other machines? So the best thing to do is to map out your network. You want to be able to quickly determine the path an attacker could take in the event that they did access your network. Where could they position themselves to then go to other machines? So a network map. A network map is ideally a visual representation of your network. So this is going to be a way in which you could easily see how your network is configured and how all your devices are connected. So why would you want to obtain a network map? Ideally, this is going to help you in your practice. You're going to be able to see how your devices are connected and detailed information about each computer. And like I mentioned, you're going to be able to see more devices in which you anticipated, as more than likely you have more devices on your network than what you really thought you did. And this is going to be something that's going to help with the HIPAA audit protocol in these ways. So for compliance, it's going to be covering under the security rule the device and media controls, data backup and storage procedures, as well as the transmission and workstation use. So the process of a network map is going to look like this. It's going to be similar to the vulnerability scan with a few different details added along the way. So like the vulnerability scan, you of course want to define the scope of assets that are going to be on the network diagram. So you want to make sure that you are aware of what devices should be on the network diagram. Again, you might have devices that might be part of a guest network, for example, or you might have maybe some cell phones from any patients that were connected to your network. You might not want those as part of your network diagram. Some devices like that might come and go. So the first thing you want to do once you've defined the scope is you want to be able to have a list of assets that are going to be displayed within the network diagram. Ideally, you're going to want to have a list that you can easily and be able to use within drafting tools. So this is something that we'll be able to do is we'll be able to get a list of devices that will be included in the network diagram. So the next step would be to gather the details. So you now have a list of devices and you know which devices you want part of the network diagram. The next thing would be to gather detailed information about the particular assets. So some things you might want to get a hold of would be IP addresses, whether they're using a fully qualified domain name, or you might even want to get a MAC address as well for labeling. Some other things you might find helpful when you do create a network diagram could be things such as if a device is wired or wireless. This would be helpful down the road. Other things might be branding. So if you have particular brands you use for different devices, this might help differentiate devices on the network. So whether if that's a particular printer you use or a particular laptop, this might be helpful to visually see as well. So how do you design the diagram? So you have a list of computers with detailed information. So next thing you want to be able to do is to actually create the visual representation of the diagram. The first thing you want to be able to do is get software that's going to be able to easily create a diagram. What works for me is Microsoft Visio. I'm able to easily create a diagram and import stencils, so you'll have not only device information, but I'll also have information such as a visual icon for a particular device. This will definitely be very helpful. So there are some other tools besides Microsoft Visio, of course. I'd imagine you can accomplish this in Microsoft Word or any painting tools built into Windows. Those will definitely get it done. There are some dedicated software you could use when you do create a network diagram. So what you want to be able to do is to draw and label the devices, and like I mentioned, if it's wired or wireless, and you're going to want to be able to input the information in which you could read. So the process, last step for the network map would be ensuring that once you have the network diagram completed, that the appropriate personnel is going to be aware of the results. So again, this is going to be something you want to treat as if it's protected health information. You're going to want to make sure that this type of information isn't left on a desk or out in the open. You're going to want to make sure this type of information is encrypted and secured. Ideally, this is going to be a roadmap that a hacker could use to gain access to your machines, and they're going to be able to easily see where a machine is connected to another machine. This is an example of a network diagram. It, of course, is going to look probably a bit different than your current network, but again, this is just an example. You're going to see that we have detailed information about each device, and we've used Microsoft Visio's free stencils in which you can use, but you can find some online as well. And all this information was gathered through vulnerability scanning and through basic network crawling. So these are going to be some examples that you might want to include. Having IP address and MAC address and maybe a labeled machine is going to be something you're at least going to want to have as a staple for each device. As you can see, it might be difficult to read, but you're going to be able to get a pretty good representation of how the network is laid out in an easy way. You also want to make sure that if some devices are off during this network map or vulnerability scan, that the devices are turned on and not off. You might have a device that might be skipped over if it's turned off or sleep. So you want to make sure that you account for those devices as well. So as a conclusion to take away from this presentation, targeted attacks against healthcare industries is at an all-time high right now. You need to be aware of where you need to improve your security and how you can mitigate risk. The first step, of course, is being able to detect and identify where your practice has a weakness. And you need to know how to improve upon each vulnerability. Vulnerability scanning and network mapping is going to be a step in the right direction to mitigate risk and prevent a breach. At this time, we can take some questions from the chat.
And if you do have a question for Kyle, you can type it into the questions box in your GoToWebinar interface. And we did have a few questions come in during the presentation. The first one is, I have heard vulnerability scans are intrusive on my network. Is this similar to a penetration test?
So that is a good question. So ideally, a vulnerability scan is going to really put itself apart from a penetration test. So a vulnerability scan is going to be passive on your network. It's not going to be the same as a penetration test, as a penetration test is going to be the process of actually exploiting the vulnerabilities. So the vulnerability test is going to be, like I said, it's going to be passive. You're not going to find it to be very intrusive on your network. If you do have any network intrusion detection systems, or if you have someone proactively monitoring your firewall, you of course will see traffic, and you're going to be seeing a device crawl across the network communicating with all these devices.
What vulnerability tools do you recommend?
So the vulnerability tools we do recommend and that I have experience with is Tenable Nessus. We really like that product. There's also Nexpose by Rapid7. There's also a free tool called OpenVAS. You're going to need to install that on a Linux operating system. That's a very good tool to use as well.
Okay, and how long does a typical vulnerability scan take?
So this, of course, can vary. So depending on how many devices you have on your network is going to really affect the duration of the scan. In terms of a particular number of time it would take, ideally I would estimate that this would take at least an hour or more to complete. Some things that could affect this as well could be bandwidth on your network. So not your internet speed that you're paying for by your internet service provider, but your local area network's bandwidth speed. If you have a congested network during the time of the scan, this, of course, could slow the scan down as well.
Okay, great. That is all of the questions we have at this time. If we missed anyone's question, we will email you directly with an answer shortly. Just want to remind everyone that we will be posting a recording of today's webinar and a copy of the presentation slides on our website, www.mceda.org. Actually, we have one more question.
Okay.
How often should the scan be conducted?
So ideally, you're going to want to at least do this once a year, like I mentioned, or if you have added any new equipment to your network, this would be a time for you to do another vulnerability scan. So if you previously conducted a vulnerability scan and maybe you've gone through a drastic IT change, such as maybe you've updated your operating systems to Windows 10 possibly, which maybe a lot of you are doing, this would definitely call for you to evaluate your computers then as well.
Great. Anybody else have a question? They can type it into the questions panel. If not, we will, like I said, be posting a recording of today's presentation at www.mceda.org. You can hover on the Resources tab and then select Webinars. If we did miss anyone's questions, we will email you with an answer. Thank you, everyone, for attending, and have a great day.